Hello, everyone, and welcome to our 10th panel for the Global Family Systems and Psychosocial Resilience Project. I've started recording, just so you know, and we've asked for folks to mute yourselves while the recording is on. And you're welcome to keep your video on. You can also turn it off sometimes for bandwidth. It's better for the audio if your video is off, but that's up to you. So, of course, the speakers, please keep your video on and your mic on. So thank you for coming to our panel. I just need to say that this project is funded by the U.S. Department of State. It's a Citizen Diplomacy Action Fund Rapid Response Grant in response to the coronavirus, to the pandemic. So what we are doing and what we propose to do and have been doing since 8 months of 2020 and into 2021 is to create panels like this with experts across the globe who are working with families and have expertise in family systems, and also in their work in public mental health and health to address psychosocial resilience in the way that they see it, where they are living and where they are working. So that's what we're doing. This is our last panel for 2020. And we'll have more panels in the spring. And my name is Dr. Laurie Lopez-Charles. Most of you we've met. And I'm doing this project with my very dear colleague in Sri Lanka, Dr. Gameela Samarasinghe, a psychologist who is going to introduce our panelists for today. So Gameela, I hand it to you.
Thank you very much, Laurie. And welcome to everyone who has joined in today. I will be introducing a speaker today the way he wanted me to introduce him, although there is very much more to say about him. So Richard Mollica is a professor of psychiatry at the Harvard Medical School. He is also the director of the Harvard program in Refugee Trauma. And he has been in clinical practice for more than 30 years. So that's all he wanted me to say about him. So Professor Mollica, it's over to you. If you want to say anything more about yourself, you're most welcome.
Okay, well, thank you so much for this great opportunity to join you today. I'm a great fan of Laurie Charles, who I admire, who's was in our clinic many years ago as a manager, and I have to say is one of the most brilliant and dynamic women I've ever met. You know, not woman, person. You know, who's it's not just a gender thing. I mean, she's tremendous. And every time I had a conversation with Laurie, I learned something new. In fact, I have a lot of books here she gave me. And, you know, you talk to Laurie, you got to spend about 5 years of reading to catch up with her, you know, so it's a lot of work. We all know that. Laurie gives you a lot of work to do. All you should know is I started the Indo-Chinese Psychiatry Clinic, the Harvard program in refugee trauma, December of 1981, when my mustache in here was black. You know, and now 40 years later, almost 40 years later, we've seen over 10,000 survivors of mass violence and torture in our clinic in the United States, in Boston, and we've been involved in Peru, training primary care doctors and psychologists and others in highly traumatized. We set up the first clinic in primary healthcare post-conflict in Cambodia 26 years ago. Still going strong. And so we've been in Cambodia, Peru, Bosnia, Croatia. We've been involved in earthquakes in Japan. Right now, we're working in the central Italian earthquake zone after that terrible disaster a few years ago in Norcia, home of Saint Benedict, you know. So, you know, we've been involved in Australia with the Aboriginal community. And so just to segue into this, the Aboriginal people in Australia, who you may or may not know, I'm close to them. We work together very closely. Judy Atkinson is one of the great leaders of the Aboriginal community in that country. And, you know, we have a course in Italy, Global Mental Health course, in its 15th year, and we have 950 people working in 85 countries, including countries you're from. We don't have anyone from the Seychelles, but we do have people from Sri Lanka, India, all over the world who've been in this course. Zimbabwe, you know, people from Zimbabwe, and it's been a great experience to meet these people in the course, in a community of practice course, because they teach us as much as we teach them, you know. It's a hard course to run because the people coming to the course know more about what they're doing than you do, you know. So you know that story, right? It's hard to work with people who are experts in their country who know a hell of a lot more than you'll ever know about their country, trauma, et cetera, you know. So I always begin, my Aboriginal people ask me to do this, my colleagues, and I do it. I always take for 1 minute to pay reverence to our ancestors, our parents, our grandparents, our great great grandparents, our great 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 grandparents, our ancestors, because we would never be here today without our ancestors. And of course, I'm not going to go into the mirror neurons, but you know, our ancestors are in our brains, embedded in those mirror neurons. You know, and in Italy, we say in Santa Croce, we have Dante and others, and we say we have to stand on the shoulders of the great ones. And the great ones are our parents, our relatives, our grandparents, our great grandparents, you know. And so let's just take a minute of silence to honor our ancestors and also honor the elderly. You know, 80% of people died of COVID are elderly people, to honor all the grandparents that have died from this terrible pandemic. You know, so let's just take a minute of respect for our ancestors, you know. Well, thank you. And whenever I do that, I can hear my father talking to me, his Italian immigrant, who's saying to me, says, son, work harder. You know, so we have to we have to listen. I listen to my father. Work harder. Okay, fine. So look, what I want to do today is very briefly. We tried for about 10 years now, more since 9/11, because we were involved. We were at 9/11 a few days after the attack. It was quite an extraordinary situation, and to help the doctors there deal with the catastrophe. And so we've been working on a self-care protocol for, since 9/11, since 19 years now. And you know, because people who work with traumatized communities and patients know that self-care is essential to our work. We had a small master class in Italy every year where people came from Rwanda and Peru and other countries, and they all demanded self-care. And then we work with the Syrian American medical group, SAMS. They were supervising people in Syria, and the next week, the person they were supervising had been murdered by the government, Assad regime, you know. And they were blown away by this. I mean, how many people have actually supervised people where the people you're supervising are being targeted and murdered? This is heavy. I mean, can you imagine you're seeing your student and next week they could be shot in the head? And the patients they were treating were also murdered, you know. So I was asked to do a self-care course for them about 2-3 years ago, and we did it. So out of the self-care course came a protocol, and then when COVID came, we adapted the protocol to a COVID toolkit and then a one-page pocket card. And you guys can all freely access this on www.hprt self-care. Laurie just put it in the chat for you. And I'm working on an animal piece because at the end, I'll talk a little bit about plants and animals, you know. So using plants and animals, because we have to reconstruct out of COVID the terrible damage we've done to the natural world that led to COVID. You know, what the CDC as a whole division called One Health, that relates health to environment, to animals and plants. And they predicted this is our fourth pandemic that leaped out of wildlife, the torture of wildlife, you know, and the terrible treatment of wildlife, and more are coming unless we change this situation with wildlife. This is just the first of many pandemics that are coming out of wildlife, because we're doing absolutely nothing in the world to change this situation of the torture and terrible abuse and killing of wildlife, trafficking of wildlife. You know. So it's coming. We're just in the midst of a pandemic. We're gonna have another one in 2 years. You know, so this is just the beginning of a life of pandemics unless we fix this situation with the natural world. And as I said to Laurie, plants and animals. This is a family course, you know. So plants and animals are our brothers and sisters. For me, the plants and the animals are our brothers and sisters. They're part of the family. So whenever I lecture to doctors about diabetes or heart disease, I always bring in plants and animals. Because you can't be treating diabetes and you look out the window and your whole world is going down the toilet bowl, right? I'm treating diabetes, I'm looking out the window and my whole environment is being destroyed, right? And birds and all the animals are being killed, you know. I mean, what is that? So you're treating the diabetes, but you need to bring nature into your treatment. So I'm a strong component, a proponent of bringing plants and animals into family therapy, into all medical care, you know. I'm writing about this now, you know. So let's go. Can we run through any questions so far? Let me open it up for any comments so far. Okay, good. And so we're going to run through the little pocket card, but you can find the protocol and the toolkit on our website. So if we can show the first slide. So here in the first slide, I'm just introducing the group, Laurie's group, your group here. Okay, next slide, yeah. I don't want, with the mission statement here, I don't want to say too more about this because this all needs to be updated. You know, we have almost 300,000 people who died in the United States. The only point I want to make here is that we haven't had new data from the CDC. We have had some data from Amnesty International. Doctors and nurses, psychologists, and especially health practitioners who are people of color are dying from this disease. I just got a report today that we say 160 doctors died in Italy, 40 nurses committed suicide. Today, it's 220. And this idea that 60,000 health practitioners in June, the last time the CDC reported, were infected and over 600 deaths. This is way a gross underestimate of how many doctors and nurses and psychologists and others have died all over the world and have given their lives to fight this COVID epidemic. And I want to honor those people who really right now are getting sick or being infected or have died from this pandemic. And that's all I wanted to say here, is that COVID has had a huge impact on health practitioners, and in the studies in England and elsewhere, especially people of color who are not medical doctors and nurses, but are emergency room people driving frontline workers, people driving emergency vehicles, people working in nursing homes, people working with the elderly. I mean, the impact on people of color has been huge, huge. And we have no data on this. We have no data on this. And we'll talk about this in a minute. So if you look at the 5 points I want to make here briefly, is at the top of the, go back to those 5 points and I'll run through them quickly, is before the epidemic hit, in America and England, we had massive problem with burnout amongst doctors. Now, burnout is usually a term related to organizational failure. Then you have secondary trauma, secondary traumatization from absorbing the trauma from people who've been traumatized, compassion fatigue, it goes on and on. But that term doesn't pick up the challenges. So 50% of American doctors had burnout. COVID hit. Now you can imagine what the burnout is now. But burnout is more institutional. It doesn't capture really what's going on with COVID. And let me run through some of the unique challenges of COVID to the healthcare practitioner and their families. Because COVID is a rare situation where you can kill your family members by taking care of patients. And this has happened. You're in the hospital, see a COVID patient, you come home, Granny's there, 86, she gets infected from you and she dies. The home is not even safe. There's no safe place to go. Terrible, isn't it? Your family, and and with people of color, they may be living in crowded conditions where they can't even go home. They have to live in a hotel, or we set up in our hospital hotels for practitioners so they don't need to go home and will infect their family members. Now, this is a very big story. I hope Laurie and you guys can talk about this, is the family has been threatened by COVID pandemic, not only infection in the community, but infection from the providers themselves. And there's a lot written about this coming out now, personal anecdotes. And not even in the military, or in American military, are you asked to bring your family into a war zone. But in COVID, you are. And now I've been talking about this for a long time. There's very little research in American medicine and English medicine on family impact from being a doctor. Can you imagine? Now, I've taught a course at Harvard for 5 years with my wife, who's the head of women's health at Mass General, is a pioneer in women's health, and 2 pioneers in the Ballant Group work, self-care Ballant Group work in England, and a poet from Miami. And we had the top doctors come from all over the world, from Mayo Clinic, from Cleveland Clinic, from Ireland, from all over. Guess what? They had pay, they had power, they had prestige, they had privilege, and their families were being destroyed by their careers. People in the family of doctors committing suicide, children in the mental hospital, people on drugs and alcohol. I mean, can you imagine that we have no research on this? And I'm asking Laurie to help me write a paper about this, maybe an op-ed, because, we got to do something about this. Now, in my profession, 2 things happen. One is The doctor is in a suit of armor, like a knight of armor. They come to my course nearly so defended that it's only by the end of the course on self-care and resiliency that they will talk about this. They'll say, "Oh, Dr. Mollica, can I talk to you?" I go, "Okay." Famous woman, important doctor. "My husband wants to divorce me because I'm never home. I'm never home. Or when I'm on the dinner table with the kids, I'm on the cell phone and the computer all night. Or giving 16 extra hours a week, well documented on the medical record." Can you imagine this? The terrible story we have with the family of now COVID has made it 10 times worse. So we say at the top of our protocol, take care of yourself, your family, and your loved ones first. Can you imagine that, saying that to the health professional, the psychologist, the social, take care of your family first. We used to have a saying at Yale many years ago when I was at Yale. They used to say, never get to the point where your son and daughter says to you, "Daddy, I wish I was your patient so you can spend some time with me." 10 times worse. The doctors love this. When they go, "You're talking about self-care and you're talking about my family? Congratulations. First time anyone has ever talked about this to me." I said, you got to take care of your family and loved ones first. That's the beginning of self-care. Does that make sense? Any comments on this? This is a huge area for me. This is one of my passions, this number one. Any comments? Anybody want to say anything? So I'll run through the others quickly because we don't have a lot of time. Moral injury. The people at Brigham came up with this. Moral injury is a term from the military. You're asked to do things that morally are not correct. Like you go see a patient without proper protective devices. You don't have medication. You're burying, your people are dying and you can't talk to the family. Moral injury means that you're breaking your own moral code in providing the care you need to provide. In the military, you could be in a situation where you hurt somebody, but you didn't mean to because you're shooting a bomb or whatever. So moral injury is very important because moral injury means you're in a morally ambiguous situation. And Diane Silver, the journalist, called this deep soul wound. Deep wound in the soul. And a lot of soldiers come back from Vietnam and other places, and they've been destroyed by the things they did that they know they shouldn't have done or they couldn't avoid doing. The doctors today and the nurses and the people, the health workers, health practitioners at every level are in the same situation. Like in a nursing home, people are dying, but you don't have the equipment to take care of them or the knowledge or the skills. Suffering of the innocent is a term from your fields, the fields of mass violence, torture, etc., is that you see innocent people suffering. When I went into Site 2, the largest Cambodian refugee camp in 1988, 90, 91, and I was there for many years working there, I saw tens of thousands of innocent people who went through Pol Pot genocide, came into the camps, were suffering there from the terrible conditions in the camps. And as a doctor hearing these stories, I felt completely impotent to do anything. So we did the first research ever done on a mental health in a refugee camp as a way of dealing with this. This is suffering of the innocent, when innocent people suffer. With COVID, when we have mostly the old people dying. I look today, the average age of death is 80. There's 80-year-old people who are dying. What did they do to deserve dying? They're innocent people. I had a 35-year-old patient and one of my staff died. Hispanic guy, 35, died of COVID. How's that possible that a 35-year-old innocent, nice guy dies of a virus? This is suffering of the innocent. The enormity problem means that we're facing a problem so big we go unconscious when we think about it. This is a term from the famous ABC correspondent, my good friend Bill Blakemore, who was a war correspondent, a climate change correspondent. And he said, when you look at mass violence, you look at climate change, problem seems so enormous, everybody goes unconscious. 1,000,000 birds dropped out of the sky in New Mexico a couple of weeks ago. I saw this. I'm looking at the sky. I'm seeing the birds falling down dead out of the sky from climate change, the fires in California. A snowstorm came that never came in September in New Mexico. It was 100 degrees, then a snowstorm. No insects because of a drought they never had. What is a little peanut like myself gonna do seeing 1,000,000 birds fall out of the sky dead? What am I gonna do when I got a president who has no policy and people are dying every day in my city, my state, and my country? This is the enormity problem where you just go, I can't even think about this. It's too big. And then finally, and this is something I'm sure you guys talked about, is the self-care approaches, giving doctors meals, having them go, they're useless. They're good, but they don't change the root causes of burnout, and they don't change the root causes. There were some wonderful papers in the New England Journal of Medicine on this. The self-care approaches advocated by the conventional system are a failure. They don't change the root causes as we're talking here, and they don't change the root causes of medicine before the pandemic, which is the industrialization of medicine through the biomedical model to make money. And that's where health disparities and everything comes from. All the bad things come from. Making a factory, productivity, money, productivity, surgery, all this stuff. I can go on for this for hours. Finally, all of these elements are made worse for you if you're a person of color. You may live in an overcrowded situation. You may be a hero at work, and then when you leave work, I wrote a paper in Lancet, maybe Laurie can share with you, about racial trauma amongst health practitioners. You're a hero at work. You go out in the community, people calling you the N-word. They're saying, if you look Asian, cursing at you and saying you caused the pandemic and even trying to hit you. And there's a lot people have been writing about, doctors have been writing about this. So racial trauma, we don't know how to provide better care for people of color around self-care. This needs to be developed. And now if you look at the toolkit, we'll go quickly to the toolkit. So this little toolkit's coming up. Here it is. You can see this toolkit has the top priority, and then it runs through mission, skills, all the different elements. Since we don't have a lot of time, I'm not going to go through all of them. Some of the important ones are, one, I already talked about the family. Two, the hypocrisy of most of our systems, that leads to burnout. The industrialization of medicine. Peer supervision is essential. Empathy leads to burnout and stress because empathic people absorb the pain of the patient. And we have a video on this if you want to see it. Reflection and meditation, very important. We're big on nature. We really promote, you guys live in beautiful places. Even if you're in a city and live in an apartment with no plants, you can look out the window and see butterflies. And environmental justice means people of color need access to plants and animals, period. My son runs a camp, a nature camp, for kids from the city who don't live around trees and plants. This is common, and they come they've never seen a goat or touched a chicken or touched a deer or seen a wild animal. And the first thing they say when they're in the forest is, nature is not racist. Can you imagine this? The owl, the bird, the deer, the opossum, the goat, the chicken doesn't care if I'm black, green, or yellow. Doesn't it to them it doesn't mean anything. And the kids pick this up, little kids in primary school pick this up immediately, how nurturing it is to be in the natural world. Because they don't experience the racism that we have in our society. Isn't that fantastic? And the kids, to see these little kids with the goats and the chickens, it's wonderful. Or see them walking on a trail and seeing an owl in the tree. They're so excited. It changes their lives, you know. This is called environmental justice, and we have to promote environmental justice, you know. Everybody needs access to nature. Even if it's just looking at the birds and the bees and the butterflies outside your window, you know. So I'm going to go to the final point here. If you can show the last slide. This is my totem. You're going to see this beautiful snowy white owl. Isn't that fantastic? Beautiful animal. It's a long story. This animal, this owl changed my life, and I'm sure all of you have had great spiritual experiences with nature. So, Laurie, I'll leave you at that point. I hope I left plenty of room for discussion. And all this material is online for free. You can download it. And I will look at this beautiful animal. This animal is my totem, you know, and we have a close relationship, you know.
Well, welcome. We welcome your totem to the panel. I think Gameela and I always have so much to say, but our first thing is for the folks who came and are here to hear you. So we'll open the floor to participants and folks that have questions or comments or thoughts.
Yeah, I'd like your comments. Yeah.
Yeah. And I don't think we have a hands up feature in WebEx.
We have the hands up. Yeah. Go ahead. Yeah.
So you can,
Saliha, please go ahead and ask your question.
Laura, is that in the chat or yeah?
I don't see a question yet. You were muted.
Yeah.
Yeah. The usual thing we have to say a few times. Your mic is muted. Salia has in New York City, Richard, a lovely colleague. She maybe has posted it in the chat. Oh, there's some comments in the chat.
Oh, Laurie, can you hear me?
Yes.
Yeah.
Yes.
Yeah,
Okay,
please go ahead.
sorry, my mic was not working for a second. I apologize. Thank you, Gameela, and thank you, Richard. That was wonderful. Couple of things. I'm curious about the story of the owl, if you would care to share. And my comment is, when you were talking about the doctors and how they were the industrialization of medicine, and how you were talking about these people who were coming from like doing all this work in their field and losing their family members. As a family therapist, I continue to see how much the stress of work, framed as the status of work, gets unspoken.
Yeah, right. Absolutely. Right.
And you are dealing with the world's best. But when we talk about industrialization of medicine, I don't think we are capturing, I'm totally for that term, but I don't know how to capture, and I'm curious to hear your thought and others' thought on how to capture the domination value that's built into all our systems, and that we euphemistically call it having a better life or climbing the ladder.
Yeah, right. Well, thank you. You said something very moving and sad for me. I took, I was a proponent of social medicine, and I took a clinic for the poor. I wrote this in my book, Healing Invisible Wounds. I took, in 1981, I tried to provide the care to the poorest people who had no access to health care. And I used my privilege at Yale and at Harvard, to bring opportunity to the poorest people in my community. For 40 years, it was a battle. I was attacked. They tried to destroy the clinic, tried to destroy me, even though they pay lip service to these progressive ideas, they don't believe in them. When you cannot have a clinic where the minority is the most beautiful clinic at a prestigious hospital, and ours was. Our clinic was an art museum. And people came in and they would say, how come this refugee clinic doesn't smell of piss and shit? Because these are refugees. Why is this clinic more beautiful than the clinic for the richest Americans in the hospital at Mass General? They couldn't understand us, you see? No, I'm serious. I'm telling you, this has been a battle. So when you don't have the privilege of Harvard or Yale, or the privilege, John Hopkins, when you can't, or you're in a fabulous institution, you can't bring privilege. It's a battle. I mean, for the people working in social medicine at the community level, they're being beaten up every day by the conventional system. Not only do they have all the things to repair in a society, but they also have to fight the system themselves. They have no money, no pay, they're poor resources, they're always looking for grants. I mean, it goes on and on. I mean, it's a nightmare. When you choose to work with the poor, your status goes down. When you choose to work with women, it goes down. When you choose to work with sexual abuse, it goes down. When so our clinic went down to the bottom because we were dealing with all the low status. In other words, the doctor and the nurse and the health worker takes on the status of the patient. Now, because of my training at Yale and my philosophy, I did the opposite. I said, let's do the opposite. Let's make this clinic the best clinic at the hospital. And we achieved that. We were able to achieve that. So I would agree with you. I think we cannot accept being put in the low status box because our patients are considered low status. We have to fight that. That's a mental thing you got to fight. And this even gets in with family therapy. Why is family therapy? No one does it. In our hospital, we have very few family therapists because the system as a whole is trying to destroy the family. So why would you want to have family therapy when capitalism, from my point of view, is trying to destroy the family? Main goal of capitalism is to destroy the family. This is my belief. I'm just telling you a very political comment here, but I believe this. I've seen it. Every refugee I've seen in our clinic, and Laurie knows this, we've had to work to preserve their family from the brutality of the society. I'm just telling you the honest truth. 10,000 survivors of torture, refugees, we've seen. You have to support them to preserve their family and their dignity and their culture, their cooking. I mean, we do a lot with cooking, for instance, food, because in our society, what is home? I mean, a famous Irish poet said there's only two stories. Who am I? And I'm coming home and I'm leaving home. Those are two stories, right? And I agree with this. And so in our communities, home is a kitchen that smells like the food of your grandmother. So in an Italian home, you have to have, no matter how poor, I was very poor as a kid, no matter how poor you are, you got to have the smell of rosemary, garlic, oregano. Otherwise, you're not home. And so we also have cooking classes, history of food. We do all kinds of things with food. And people, by the way, I don't know if you do this in family therapy, Laurie. People love talking about cooking. They love it.
Yes.
And it brings the family together, because my mother said when the kids are 12, she teaches them Italian cooking. So she taught all the kids how to cook. Everyone at 12. So when they hit 12, they have to learn the masterpieces of my mother's cooking. But I talk to all my patients. Whenever I had a dead end, I said, what'd you cook last night? And then it opens it all up and we go into a big discussion.
Thank you, Richard. That was very, I love the political nature, because without that, I don't think you're doing real work. And I appreciate, I've not heard anyone say this, capitalism is destroying the family.
Well, that's the goal of capitalism, because if I isolate you,
yeah, exactly.
Individual, say I got
it's you. It's the best way to break an individual is to break their family.
Yeah, and if I got you on the cell phone and on the internet working Sunday, all day Sunday, when you should be going to your religious service and your family, I'm making a lot of money off of you, and you're at home, not even relating to your kids.
Yeah.
And your spouse. I mean, why are they doing this? And medicine, we found out in medicine with the new electronic medical record, the doctor gives an extra 16 hours a week over and above their 60 hours a week on the damn medical record without getting paid. And this comes from family time. Can you imagine that?
Yeah. So the question that comes up is then, as a mental health professional, I think about hosting groups for doctors to come and talk, to be in community, when the best prescription could be go be with your family.
Well, and help them get the lack of the denial. To see, they're in denial, so you need to prepare them. Like the doctors, the big shot doctors who come to Italy, they're in denial. When we do the course in Italy, global mental health course, it's 60% women, and so women all over the world are making a big difference in human rights. In the human rights field, it's mostly women, and I think one has to, in our field, because my wife started women's health 5 years ago. It was one of the first promoters she's a primary care doctor, internist, and she started women's health. That it was clear for me that in 1981 that we were copying the women's movement in health. You guys probably all know our bodies ourselves, which has been translated into every Nigeria, Arabic, etc. And that was a revolution, in women's health. And then it led to my wife's revolution, is looking at the biology, that women, like a heart attack in a woman is completely different than in a male. But all the research was on men, and women were dying of heart attacks because no one knew how to diagnose them. And then you had this horrible problem of hysterectomies, where every woman was getting a hysterectomy that they didn't need. And my wife was part of shutting that down. So in the refugee field, we used the women's movement, really to, we copied the women's movement, really, to be honest about it, in not a conscious way, but I think the women's movement really had an enormous, 38 years ago, had an enormous impact on social transformation of medicine, transforming medicine, I'm not paying lip service to this. I really believe this is true,
Yeah. One of the things I appreciate you bringing to the panel is I mean, in general, I appreciate this when people are doing the kind of work that they talk about doing. And I really appreciate that about you. You really are doing, I mean, when you ask, what do you think? You really listen. You want to know.
It's true. I
Yeah,
do.
yeah, you do. And I like that that's also very consistent about you. And it's the right question, right? Really, that we should be doing now, especially with family systems work in this pandemic. So I feel the same way about you, that you were very gracious in your comments about me. I always learn something. So I echo Saliha, because I've never heard a mental health and public mental health person talk about capitalism destroying the family. I've heard economists talk about it, like
I live it every day. I see.
yeah,
You take a refugee
yeah,
person of color, and they come to this country, and then you take a hamburger meat grinder and you stick them in, and they come out a hamburger.
yeah, yeah.
Our clinic prevents that. We don't want you to come out a hamburger. But that's what happens. The clinic creates a bubble. I had an amazing
Mm,
experience where, with my 150 patients that I see, who are mostly 100% non-English speaking, the fact they were in therapy with us in the clinic protected them from COVID. None of them died from COVID, and very few were infected because they were in therapy, because we're part of a family system. In other words, they consider me, as their medical doctor, part of their family. So our group was able to get in very early on to teach them how to defend against COVID. You understand what I'm saying? So I began to notice that our patients in therapy were not getting infected and dying. Well, people who were not in therapy were getting infected and dying.
yeah. Interesting. Health promotion, kind of like the work that you've been
Well,
doing for so
look at
long.
family therapy also as health promotion.
Yes.
Yeah, bringing health promotion into family therapy. See, I think I said this to Laurie. What COVID has done is take all of your old ideas, no matter how good they are, and trash them, and
Mm,
try to come up with, like I had to look at our work
mm,
last 38 years and say, oh, we think we're doing a great job. Maybe we're doing a lousy job, especially with people of color. Let's look at what we're doing and trash it and come up with something new. And we came up with a lot of new ideas. Even the good people have to trash what they're doing and come up with a new idea. Does that make sense? What do you guys think?